Dangers of taking over-the-counter painkillers. If you take a look in your first aid box or medicine cabinet, it's likely to contain at least one type of over-the-counter (OTC) painkillers. The most commonly used OTC painkillers are nonsteroidal anti-inflammatory drugs (NSAIDs), such as ibuprofen and naproxen, along with acetaminophen, an analgesic used to relieve pain or bring down a fever. The risk of these side effects is higher in people who take these drugs daily and for an extended period of time, and also for those who take prescription medications, especially painkillers. Women who are pregnant or trying to conceive should not take any medicine, including OTC pain relievers, without consulting a doctor first. Number 1. Kidney malfunctioning. Many studies have linked overuse of NSAIDs to kidney problems. With ongoing use of ibuprofen or naproxen, some people may even suffer from kidney failure. However, this occurs more commonly in people who have other coexisting risk factors, such as diabetes or high blood pressure. Number 2. Interferes with antidepressants. NSAIDs can reduce the effectiveness of certain antidepressants, known as selective serotonin reuptake inhibitors, SSRIs. Furthermore, taking NSAIDs while also taking antidepressants can be dangerous. Intracranial hemorrhage refers to bleeding under the skull that can lead to permanent brain damage or death. Number 3. Blood thinning effect. Ibuprofen, naproxen and aspirin all have a mild blood thinning effect. This will not cause a problem for most people, but it can be an issue for people already taking blood thinning medication. Unintentional overthinning of the blood can lead to an excessive risk of bleeding. If you are taking a blood thinner, do not take NSAIDs. Instead, take generic Tylenol, acetaminophen, to get relief from a headache or aching muscles or joints. Number 4. Liver dysfunction. Liver damage is a common risk you take when popping OTC painkillers without consulting a doctor. Of the various OTC medicines, it is primarily aspirin and acetaminophen that can cause harm to your liver. It is due to intrinsic toxicity and often linked to high doses. In most cases, NSAID-related liver injury has evidence of an immunologic cause. Some cases are also related to toxic metabolites of some NSAIDs. Number 5. Stomach problems. Although ibuprofen and naproxen do not generally affect the functioning of the liver, these NSAIDs are not good for your stomach. Even aspirin is bad for your stomach health. In fact, overuse of these painkillers can harm or irritate the stomach lining. This in turn can cause loss of blood from the irritated area, stomach aches and ulcers in some cases. Number 6. Heart failure. NSAIDs are also associated with an increased risk of heart failure. NSAIDs and selective COX-2 inhibitors are associated with an increased risk of hospital admission for heart failure. Other options for pain relief. Looking at the side effects of common painkillers, you need to stop popping a painkiller whenever you have a headache or stomach pain. There are many effective and safe alternatives for pain relief that do not come with any of the above-mentioned side effects. Thanks for watching. Subscribe for more videos.